antiviral of acyclovir. So anti-cancer drugs are also known as anti-neoplastics. When we think of anti-neoplastics or anti-cancer, you always think of chemo also. So it's a form of chemotherapy. So getting rid of the good cells and the bad cells is the focus on what the anti-cancer drugs are doing, is to kill off the cancer cells. But at the same time, it's also depleting the good cells. So there's some influences of cancer as a whole. Genetic, self-explanatory, inflammatory, self-explanatory, infective is your HPV, very popular with the female the uterine cancers and ovarian cancers with HPV. Environmental is those that are high-fat diets, which goes along with dietary. So in our environment, a lot of high-fat foods. And then styrofoam. If you notice, a lot of restaurants are not using styrofoam as their takeout containers anymore. They're getting more into cardboard with plastic. And that's because the carcinogen bakes into the food as it's warm. And then when we re-warm the food, we're eating the carcinogen. So you'll notice that a lot more places are getting rid of that styrofoam. Even though styrofoam is cheaper, but it has a link to carcinogens, also cancer-causing agents. And then dietary, we mentioned high fat, especially with colon rectal cancer, high fat, low fiber is usually what they say with that. So a lot of your different types of anti-cancer drugs are listed there for you. We're going to go and talk about each one of them as we go along today. With cancer chemotherapy, there's different types of therapies. Keep in mind, palliative chemotherapy is those that are just trying to sustain the quality of life, but the end result is still the same with end-of-life situations. So, biggest thing about side effects when it comes to the cancer drugs. Keep in mind, cancer is resistant. So you might hear patients that have multi-drug therapy or different drugs therapy depending on the stage of the drug. So if you don't know anything about cancer, let me mention that it's staged. Stage 4 worse, stage 1 mild. It all comes to what they know as the TNM. With the TNM, it's the size of the tumor. The N stands for if there's lymph node involvement, and then the M stands for metastasis. So if the size of the tumor matters, or the extent of the tumor, lymph node involvement, and if there's metastasis, where it has spread. So all of those play a role in how they're going to get diagnosed or what the prognosis is and how they're going to treat it. When it comes to outpatient clinics, a lot of them may come in for their anti-neoplastic therapies. But one thing they always do, no matter when they're getting the cancer treatment, is a CBC. Because as I stated, it gets rid of the good as it gets rid of the bad. And the good stuff would be your red blood cells, your white blood cells, platelets, hemoglobin, hematocrit. So white, red, blood cells, platelets, hemoglobin, hematocrits. So again, when it's getting rid of the good, it's getting rid of the bad. Another thing about when it comes to chemotherapy is pre-medication. We should, as caring compassionate nurses, pre-medicate our patients if we know they're going to get chemotherapy. Pre-medicating them with an anti-hypnotic or anti-nausea, vomiting drug, anti-hypnotic. That's one thing. We should pre-medicate them before when it comes to our cancer therapy. One, it will reduce nausea and vomiting post-chemotherapy. So if we pre-medicate them ahead of time, it can then, and will, and should, reduce their nausea and vomiting after chemotherapy. The other one is administering an antihistamine. Antihistamine, if you know anything about chemotherapy, one of the biggest side effects is alopecia or hair loss. An antihistamine can reduce the amount of hair that is lost. Another thing, if you guys have ever heard of a cold cap? You guys heard of a cold cap before? Yes, kind of? What is it, Haley?
Well, I don't know what temperature, but it kind of looks like you're at the hair salon, like a big wrap around your head, and it's just like excruciatingly freezing cold.
Yep, it's exactly what it does. And what it does is it vasoconstricts the hair follicles, so they don't have the potential to lose as much hair, if any. So with that chemotherapy, a vasoconstriction holds on that follicle is an easy way to understand it. It has been very popular the last couple of years. Wasn't around years ago, but they're trying to now. Doesn't mean that they're not going to lose it eventually, depending on the strength of the chemotherapy and how long they have to do the treatment for. Again, depending on the extent of the tumor, lymph node involvement, metastasis. So all that plays a role. But the cold cap is to reduce the alopecia, and along with that antihistamine. Also, chemotherapy will cause itching. And so with the antihistamine, it will decrease itching. Now, we don't want somebody with chemotherapy who's already immunosuppressed with the chemotherapy start scratching their skin to oblivion, because then we have impaired skin integrity, more risk for infection. And they themselves cannot fight that infection, right? Because their white blood cells will be decreased, as we stated, decreases that strict medical asepsis for that patient. The less cooties, the better we expose them to as a whole. So with that said, alkylating agents is one type. We're only going to hit key points with these. We're not going to go in great detail. Only the key points with these, because we can be here forever with these, or all of them with the anti-neoplastic drugs. So the alkylating agents treats 3 types of cancers: leukemia, lymphoma, and multimyeloma. Leukemia, lymphoma, multimyeloma. It has also been known to also be used for solid tumors. Solid tumors in 6 places: breast, ovaries, uterus, lungs, bladder, stomach. Breast, ovaries, uterus, lungs, bladder, stomach. Alkylating agents. And you'll see one particular type in this little slash is a generic drug, generic name of one of the particular alkylating agents. You cannot go wrong with talking about anti-neoplastics or the side effects, because it's an adverse reaction, with decreasing the good and the bad, right? So those are adverse reactions. Side effects would be the nausea, the alopecia. Those are side effects as a whole. So, nursing intervention when it comes to this particular drug is, of course, every patient across the board will get a CBC, so monitoring blood work or lab values. If you ever know patients who had cancer, one of the things we do is encourage them to eat small frequent meals. They aren't going to eat a large meal at any given time and sit there and eat and eat and eat. Now this is where it goes against kind of what we already always said. They're on restricted diets. We don't want to give our patients anything from home. The family shouldn't bring in anything, blah, blah, blah. This case is a little bit different. We want them to take the calories. We want them to eat. Because one thing that also chemotherapy does is causes anorexia. They don't have an appetite. Another reason why they don't have an appetite is they get stomas in their mouth or the whole GI tract. From mouth to anus, they have stomas. So the mucous membranes are then disrupted. If you ever had a canker sore yourself, swallowing any temperature change in something you drink, it burns. Think about that lining from your mouth to your anus, and of course they don't want to eat because it's a side effect of the chemotherapy too. So hydration is also important when it comes to this. Metabolite that's been around forever is methotrexate. Methotrexate falls under the anti-cancer, or anti-neoplastic, or chemotherapy world. But they also use it a lot with the rheumatoid disorders. So it's classified as an anti-cancer under the class of anti-metabolite, but it treats so much more than just, it's been around forever and a day. Forever and a day. Another metabolite, a generic, is bulleted there for you. also known as 5-FU. This is the strongest chemotherapy that is out there. And the reason I said what the generic or trade name is because it is the strongest one out there for cancer. The uses are all the cancers listed there for you guys already. And the side effects is listed. Stomatitis is a fancy way to say those canker sores that go from the mouth to anus. Stomatitis, again, lines the whole GI tract. And then bone marrow suppression, that is self-explanatory when I talked about getting rid of the bad, white blood cells, red blood cells, platelets, hemoglobins, hematocrit. So that might just be a fancy way to say what I already have a couple of times already. So it must be important. It must be. So, with dealing with this strongest gun out there, again, just to reinforce, 30 minutes to 60 minutes prior to administering any cancer chemotherapy drug, specifically mentioning the strongest one out there with the metabolite, anti-metabolite, of course, to decrease the nausea and vomiting. Anti-tumor antibiotics. Again, first bullet tells you a generic. The most popular of the generics, mind you. Why they like these anti-tumor antibiotics is because it inhibits protein and RNA synthesis, and it causes fragmentations. So it inhibits protein and RNA synthesis, causing fragmentation. So fragmentation would be the breaking into little particles, right? The fragments, and then dissolved and gone is the plan when we're dealing with these anti-tumor, anti-antibiotics. Nothing fancy to say about the nursing process with them. Plant alkaloids. Plant alkaloids is really from a plant. Tells you their uses already, so you don't have to write. And the side effects, again, stuff that we've been mentioning the whole time. Same thing with the nursing interventions, nothing to specifically tweet out. Except maybe the peripheral neuropathy. What vitamin helps with that? B6 or 12. You could actually use both. B6 would be better, but B12 can also be used. All right, so lysosomal chemotherapy. Oh, I should have forgot the M&Ms. So in the world of lysosomal therapy, it actually is a anti-cancer drug surrounded by a fatty coating called a liposome. The fatty coating breaks down slowly. It states to decrease the side effects of that chemotherapy. So as it breaks down and slowly releases that chemotherapy, so does the side effects. So if you think of a peanut M&M without the candy coating, the peanut itself would be the anti-cancer, around it would be the chocolate. So think about the actual peanut M&M, again, without the candy coating. And so again, why would they use that is to decrease the side effects. As a typical, like a slow release, it decreases side effects like the alopecia, the nausea, and the cardiotoxicity. Toxic to the heart. So that's why they would choose to use liposomal therapy. Hormonal antagonist and agonist slows the growth of all hormonal growths or tumors. So it slows the growth of hormonal tumors. Here are some of the agents that are listed under that umbrella there that would be used, considered to be these agonists and antagonists. So it has to be a tumor that is caused by a hormonal tumor in order for that to work. Miscellaneous chemotherapies, interesting fact, they're classifying vaccines now as a type of various chemotherapy because of the T-cell immunity. So, which is interesting. A lot of research has been done on that. Questions about any of those we mentioned? It's a lot. We're just going to build on that anti-cancer stuff.